And it's a very pertinent session, and it's on the nutrition in the elderly. That again, one of the very important, as important as the medication, as the care, and as the looking after. And I invite Dr. S. Ramdas, who will be speaking on this subject. Dr. S. Ramdas, he is working in the Ramdas Hospital. So over to you, Dr. Ramdas.
Thank you, madam, for the kind introduction. We'll now discuss a topic very relevant in geriatric practice, namely nutrition. Now, we have been all talking the whole day about healthy aging. Now, nutrition is also all about healthy aging. But before we talk about that, what's the difference between chronological age and biological age? Every year when you celebrate your birthday, you get 1 year older, and that is your chronological age. But what is your biological age? When you are 60, someone mentioned earlier, and but you're still feeling about to retire, but you feel that you're only 40 and behave like that, probably that's your biological age. And the classical example would be Professor Sharma sir, who just celebrated his 70th birthday a few days ago. His biological age may be only about 50 years. Now, what is it that causes longevity? Is it nature or nurture? Science has proved that genes play only 35% role on one's longevity. The remaining 65% is all about environment. And environment essentially consists of diet. When you've got unhealthy diet, along with comorbid factors like diabetes, hypertension, smoking, alcohol, and toxins, etc., you have premature aging. While if you have a healthy diet with physical exercise and healthy lifestyle, you have a much healthy aging, and thus you reduce your biological age. Now, what's the scientific rationale for such specific foods in the elderly? Now, these are because many of our chronic non-communicable diseases are related to diet. Interestingly, if you correct them, it can be reversed even in old age. And as age advances, metabolic changes occur. The lean body mass gets replaced by the fatty component, which is less active, and along with that, the BMR decrease that occurs every year leads to a lot of diseases like cancers, particularly cancers of prostate, breast, and colon, which have got a dietary background, decreased fiber, increased lipids, etc. And we have got degenerative diseases like coronary artery disease, cardiovascular disease, and osteoporosis, which are related to diet. And lastly, micronutrient deficiency is common in the elderly. Now, let's have a bird's eye view of the various organs in the body and what age-related damage occurs and how nutrition will play a part in helping it. Years and years of ultraviolet light exposure can cause damage to skin, which can be corrected by vitamin A, E, and some POPs. Now, about cardiovascular system, we have got atherosclerosis and hypertension, which can be also helped by reduction of the lipids and salt. In the musculoskeletal system, we have got osteoporosis, sarcopenia, and osteoarthritis. Calcium, vitamin D, and protein can help. And down the line, in the gastrointestinal tract, even cancer can be prevented by fiber, which is because it alters the microbiome of the gut and helps you to prevent cancer. Now, what are the nutritional needs imposed by the aging process? As age advances, now bones are in dynamic equilibrium. As age advances, osteoclastic activity goes on, but the osteoclastic activity is less. This leads to diseases like osteoporosis, and of course muscles. We also mentioned sarcopenia that occurs, immune system declines, and prevention of atherosclerosis, malignancy, and obesity. Now, when it comes to malnutrition, it can be both overweight or underweight. Overweight, of course, obesity is a greater problem, and this is quite natural because as age advances, the BMR goes down, exercise becomes less, but your caloric intake still continues to rise, and this causes a net weight gain, and we know that obesity is a big problem. But in this context, I would like to mention of this interesting phenomena called obesity paradox. While we know that obesity in any form is harmful, it has been found that in some subsection of people, obesity, in fact, in some people, it only increases one's longevity. And this probably hormones like leptin or ghrelin may have a role, but there are many theories about it, but it's an interesting phenomenon. Now, about underweight, apart from frailty, anorexia, the aging can occur due to physiological causes like diseases, taste and smell, and changes the GI tract, and pathological causes like some medical diseases, the drugs we use, and psychological and social factors. Now we come to the backbone of the talk, the dietary nutrients which we use every day. We have the macronutrients, the carbohydrates, proteins, fats, and fiber, and the micronutrients, the vitamins, minerals, and the less talked about phytochemicals. Now, about the micronutrients, carbohydrates, we know we should try to avoid the simple sugary solutions which lead to obesity because they have high glycemic index. It can lead to obesity and diabetes. But what we should use are the complex whole grain cereals like the Kerala Matta rice or the bran, which is the bran in it, or even the millets. When you preserve the bran, they are the ones which are healthy and should be used in the diet. Regarding fats, meat contains cholesterol, vegetables contain saturated mono and polyunsaturated fatty acids, and we have got a particularly bad form of fatty acids called trans fatty acids, which occurs on reuse of oil, etc., and which is highly atherogenic. Regarding proteins, animal proteins are ideal because it contains all essential amino acids. Plants lack some of them, but it can be compensated if you use 2 or 3 more plants together, mix them together. In fact, there's still a lot of interest in plant source of proteins because they are less inflammatory. And regarding fiber, about 30 grams per day is required. Now, the importance of fiber is that it causes change in the microbiome of the gut. What it helps is that it prevents inflammatory diseases like diverticulitis or even cancer of the colon. Now, we come to the fatty acids. We have got the good, bad, and the ugly. The good ones are the omega-3 fatty acids, walnut, chia, flax seeds, soya, broccoli, cauliflower, etc. And the vegetarian, salmon, sardines, and mackerel, the non-vegetarian are various omega-3 containing fatty acids as opposed to the omega-6 fatty acids, which are mainly the processed food and bakery foods. Now, what is important about this? Omega-6 fatty acids gradually leads to inflammation and results in thrombosis and vasoconstriction, whereas omega-3 fatty acids reduces inflammation and causes only vasodilatation. So, we would like to have a ratio of 1:1 or omega-6 to omega-1 to omega-3, but in the present scenario, it's almost about 20:1. And lastly, I will talk about trans fatty acids, which are particularly bad type of fatty acids, because apart from causing atherosclerosis, it leads to diabetes in 2 ways. One, it causes insulin resistance, which leads to diabetes. And secondly, being highly calorie dense, it can lead to obesity, which also leads to diabetes. And then now we come to the proteins. Present evidence is that about 1.2 to 2 grams per kg per day are required. It can benefit by increasing muscle strength, prevent sarcopenia, maintaining energy balance, maintaining optimal weight, decreasing obesity, cardiovascular health, and improving and prevent diabetes. But what happens is as age advances, there's decreased response to muscle protein synthesis to amino acids. This leads to sarcopenia. I will show you that sarcopenia obesity because of the lean fatty mass being replaced by fatty tissue. And with decreased BMR, lack of adequate albumin synthesis in the liver, it leads to make yourself more prone for infections, changes in drug pharmacokinetics because many drugs which are found bound to albumin, the dose is altered and causes decreased wound healing. Now, a word about whey protein. So this is very popular among the youngsters in the gym because they use it because it contains this amino acid leucine, which is very important for muscle building. And even in the elders, a lot of studies have been done, and they found that muscle performance is improved. It protects against sarcopenia, reduces risk of falls, improves recovery from diseases, prevents cardiovascular and metabolic diseases, and even improves hepatic steatosis. But one caution you should be careful is that they are likely to be contaminated with toxins like bisphenol A and heavy metals, etc., because many of these nutraceuticals are not well supervised. So one should be careful of which whey protein you use. And after finishing the macronutrients, we'll now talk about the micronutrients. We have the water-soluble vitamins B and C, the fat-soluble vitamins A, D, E, and K, the minerals finally the sodium, potassium, magnesium, and calcium, and trace elements. But I'll particularly talk about this phytochemicals, which are not very often discussed. Now, these are extremely useful in nutrition, because they are antioxidants. The beta-carotene, which is coming from carrots, the lycopene from tomatoes, the curcumin from turmeric, and a lot of berries that we have, but the best of the lot is the gooseberry of India. We call amla or nellika in this parts. This is extremely useful because apart from its antioxidant property, it's a rich source of calcium, vitamin C, and it's also got some immune modulating property. So these are extremely useful. But one thing one should realize is that while these antioxidants are extremely good as a dietary form, trying to use them as chemicals or drugs is of no value at all. Now, coming to vitamins and minerals, I will particularly stress on two vitamins now, only on vitamin D3 and B12, because these are two vitamins which are very often you find deficiency in the elderly. Vitamin D3 in particular, if you can give about 800,000 units per day to all women after menopause, and probably all men a decade after that, can prevent falls, can be reduced by 14%, hip fractures by 26%, non-vertebral fractures by 23%. So it's a vitamin we should never forget to give. And the next important vitamin, which is often neglected, is a vitamin B12. Now, the important clinical point here is that acid is required for the absorption of B12. And as age advances, you get gastric achlorhydria. There is a decreased ability to cleave the B12 from the food and bind to the intrinsic factor. And this problem is definitely compounded by the fact that we use a lot of proton pump inhibitors. It's almost used as a dessert in every prescription. So with the result that acid secretion is less, so less of B12 gets absorbed. Along with that, there's also, it's not only B12. In fact, magnesium is so important that even that requires acid for absorption. So it's important that all of us at some stage or other check the B12 level, because it's a very important vitamin, can cause dementia, peripheral neuropathy, anemia, etc. So I think all elders should get a supplement, particularly after 60 years, it should be given. Now, something about nutrient-dense foods. What are they? Nutrient-dense foods are foods that contain a lot of nutrients, but are low in calories. They can prevent obesity, they can prevent excess free radical production. Examples are the fruits, vegetables, whole grains, seafood, lean meat, eggs, legumes, nuts, and low-fat milk. Now, about other challenges in eating, well, it was mentioned about loss of taste, which as you age advances, you feel like craving for highly salted and sweetened foods. This can be ameliorated by giving something like cinnamon or pudina or something, which can be help to mask the taste. Now, lack of teeth, dry mouth, and constipation are genuine problems. And diseases like renal diet, etc., some of the diseases which require diets which are unpalatable. The last part is economic factor. Now here I want to tell you something. We have a lot of vegetable sources in our country which are underexplored, which if you utilize, I think now we know the cost of the protein supplements are so high. Now, amaranth leaves is one such example. This is called as chaule ke patte in North India and some chira in our local parts here. Now, these are extremely good. They're supposed to be a superfood. It can actually be useful for bone health. It reduces cholesterol, reduces blood sugar. It has got a lot of antioxidant property. So we have got now the groundnuts, which have got a lot of protein, but also contains a lot of fat. We have got the soya, which is being used, and we have got, I told you earlier, we have the wonderful gooseberry. So many of these things, if you utilize, and coconuts are a very good source. I'm not talking coconut oil. Coconuts are a very good source of health. If you could make devise a method where you can actually make them cheaper product, it could be much cheaper for the people, for the common person to manage. So I think this is something which we should consider as part of the thing. Now, lastly, I would like to solve something about something close to my heart, the concept of holistic nutrition. Now, what do I mean by holistic nutrition? Does an elderly person, is it only the physical part that's important? Don't we also have the mind, the intellect, the emotion, and the soul? Can something be done for that? And here, I feel yoga is the answer to that. Now, why I mentioned yoga? Because it is not just a hypothesis. A lot of research has been done in several universities, including universities like the Harvard University, where they found, after using electroencephalogram, alpha, beta, theta, and gamma waves, and functional MRIs, they have demonstrated there is both structural and functional changes in the brain of people who do yoga and meditation. And not only that, in fact, for example, primarily yoga acts on the parasympathetic system, unlike the exercise, which regular physical exercise, which acts on the sympathetic system. And now, for example, for stress and anxiety, depression, the fear of death, are all very so common in the elderly. They have found that amygdala has an important role. They have found that alpha, theta, and gamma waves are increased, and of course, they are particularly important. They have found that cognitive decline can be reduced, and some emotional instability can be controlled. And so there are a lot of reasons why yoga should be used. And for want of time, we will discuss, but I think it's a very important part. And yoga and meditation will be a future of tomorrow. Now, to sum up, an ideal diet for the elderly would be one containing whole grains, fruits and vegetables, low-fat dairy products, fish and nuts, avoiding processed foods containing trans fats and saturated fats. For cooking, a mixture of dehydrated vegetable oils like olive oil, sunflower oil, safflower oil, and canola oil are preferable. Rustic consumption of red meat, sugary food, and drinks. High protein diet predominantly from plant source and regular exercise can prevent the dreadful sarcopenia and increase longevity. And lastly, holistic nutrition can be achieved by yoga, which can cause physical, mental, emotional, intellectual, and spiritual well-being and add life to years rather than years to life. I'd like to thank you for your kind attention. And I'd like to congratulate both Sajesh, Dr. Anita, and the entire team of this organizing committee who've done a brilliant job and listen to us the whole day. We listened to the giants in geriatrics and gave me an opportunity to present a small presentation in front of this august audience. Thank you and God bless you.
So thank you, Ramdas sir, for this excellent discussion on a very important topic. Our satiety for food and learning never ends. So still I apologize that since we are running short of time. And if at all any questions, any deliberation, any clarification needed, you can contact Ramdas sir in the lunch time. So thank you, our co-chair and all the delegates. And we conclude. Okay, sir can do it. Okay. And I invite Sharma sir if any investment. So we conclude this session. Thank you, sir.